Hi everybody, it's Dr. Satey coming to you from Beverly Hills, California. Let's talk about drains today. So simply put, a drain is some type of a tool that helps collect fluid. Now where that fluid comes from all depends on what procedure you've had done. So a tummy tuck has a potential space as a consequence of tightening your muscles because you have to separate the skin and the fat from the underlying muscles to have that exposure. Liposculpting also has a potential space because you're extracting a ton of fat. So the area of the skin down to the underlying muscles only has a little connective tissue and blood vessels and nervous system that's remnant. So what happens is your body loves to fill potential spaces with fluid. So what that drain does is it helps collect and accumulate that so then we can quantify it. So now the determining factor of when those drains come out are multimodal. The first thing is that you want to look at the quantity of how much fluid is actually coming out. Is it 50 cc's a day? Is it 75 cc's a day? Whatever that is, it goes into a little bulb. So there's a drain that comes out and there's a little bulb, a grenade bulb that's attached to it. On that little bulb has numbers. So every single day, you will actually pour this out and quantify how much fluid is being drained out. Now, the determining factor of when that drain comes out is whether or not it's less than 30 cc's a day, cumulatively. Oftentimes my patients have 2 drains in, so both of those drains need to be less than 30 cc's a day for it to be removed. The second factor is the character or color. So initially when you have your drain in, the drainage that comes out is a little bit more on the redder side. It's not blood, like thick like blood. It looks more like a Kool-Aid consistency, where it's reddish in nature. As time goes on, that color actually changes and becomes more of a straw colored or apple juice like color. Once it's in that color, it's more serous. It's no longer sero-sanguinous, which was that Kool-Aid color. That again is a great indicator that it's time to pull the drain. The third thing is the thickness of the effluent. Is it really thick? Is it more watery? Is it more proteinaceous? These all kind of help clue me in on really what's going on inside. So once all 3 of those parameters are met, I know that it's ready for those drains to come out. Now what you're thinking is, that's probably gonna be painful. It's actually not. The removal process of a drain is fairly simple. So how they're anchored onto you is by one suture. All that has to happen is one little snip on that suture. Does not require anesthesia. It's very easy. We take the drain off suction and then a gentle, slow release, and the drains come right out. Now, once those drains are removed, I tend to close that incision with a simple and erupted stitch. At the end of the day, we want to make things look as cosmetically appealing as possible. Some surgeons may not close that incision, and at the end of the day, that may not be wrong, but my practice pattern is to close it. So we went over what drains are, we went over how long they're gonna stay in, and we talked about its removal process as well. I hope that clarifies some things for you. Thank you.